Now with Dr. Darien with a question for the ER doctor right here. What should you worry about a headache? When should you worry about it?
You know,
especially kids.
And I'm glad you brought up kids, because I often talk about this with patients, and I'll start with kids, because when a child tells you about a headache, I don't know about anyone else, but I know for me at least, when I'm listening, especially to a patient, my sensors are off. My red flags are up, because I'm making sure that that headache is nothing more than a headache. And how do we know that? I think it's important to talk to a child if you can, but also paying attention to their behavior. For example, if a child is lethargic, and by that I mean they're acting out of it, just not themselves, that is a big red flag that you should bring that child in for evaluation. If that headache comes with other symptoms like sudden nausea or vomiting, eye pain, or even difficulty with balance, and we're not talking about a clumsy child, we're talking about not able to walk correctly because there's some disconnect between their brain and their limbs, that is when you want to bring up, hey, this is a red flag, let me talk to my provider about it.
What about adults?
And similar symptoms. You know, up to 96% of adults have a headache at some point in their lifetime. Migraine disorders are very common, but I always talk to patients, you know yourself better than anyone else. So if that headache is atypical, and by that I mean if it's just completely different from other headaches, that is a telltale sign. If you've got a stiff neck, a fever, if you've recently traveled, that could be an infection. And then if you have a headache that's focused on one side and it's just persistent and getting worse, that's also a red flag that you should come in and get evaluated.
And what are you seeing in the ER when it comes to kids and adults?
You know, a lot of the times I'm talking about history. Kids don't talk about their symptoms simply because they don't have the words. So often I'm talking about their nutrition, their sleep, their screen time. These are all things that can provoke a headache in a child, and getting that under control can help control the headaches. And then for adults, I'm often talking about the same things. We as adults can take that note. Sleep, nutrition, making sure that we're getting our exercise are all important qualities.
That's some good advice here, Doc. Thank you very much.